Hello and welcome back to GP Video Podcast by Nadia. So today, after a very busy day, I couldn't stop myself from giving one important and simple and short message to all of you. And that is it my thyroid? Thyroid is a very important endocrine gland in our body. Endocrine gland means it releases hormones which are thyroxine, which are thyroid hormones. Basically, thyroxine is the name of the medication that we take. Thyroid hormones FT3 and FT4. These hormones are responsible for a lot of functions in our body. They do exert effects on almost all important organs in our body. They have the metabolic effects and they are responsible for a lot of functions. So if you're getting any of the symptoms like weight gain, weight loss, high heart rate, anxiety, tremors, coarsening of hair, there are two conditions. One is high thyroid, one is low thyroid, right? Hyperthyroidism and hypothyroidism. And both conditions, in one thyroid hormones are low and in the other thyroid hormones are high. So basically you can say that when thyroid hormones are in excess in our body, everything will be hyper. So you will have a high heart rate, you will have anxiety, you will have tremors, you will lose weight. Everything would go in the hyper kind of phase, while hypo means low, means everything will be sluggish, everything will be slowed down, you'll gain weight, your mental health, you'll be brain fogged, your mental capacity will slow down, you will slow down in everything, all right? You will gain weight, you will have coarsened hair, you will have depression, everything will be on the lower side, while in hyper, everything, the metabolic rate increases, so everything will go on the higher side. So if you have any kind of symptoms, both physical and mental, which are alarming, which are not normal, like high heart rate, palpitations, anxiety, depression, weight gain, weight loss, anything that is untoward, you go to your GP, and if the GP is not performing a thyroid profile, ask them for a thyroid profile. Thyroid profile usually includes TSH, which is thyroid stimulating hormone, which is released from the pituitary gland in the brain, and that actually acts on the thyroid, and then thyroid produces T3 and T4. In hypothyroidism, which is low levels of thyroid, the TSH is going to be high and T3, T4 going to be low, because if T3, T4 are low, thyroid is not making enough hormones. That sends the message to the pituitary gland, and pituitary gland will release more of the thyroid stimulating hormone. So in hypothyroidism, TSH is going to be high, FT3, FT4 going to be low, while in hyperthyroidism, FT3 and FT4 are going to be high and TSH is going to be low. So inversely proportional. So these three hormones constitute the thyroid profile. Usually when somebody who does not have a history of thyroid disease and we ask for a thyroid profile, the laboratories usually do TSH, and if TSH is normal, they don't really worry about FT3, FT4, which is usually a good thing to do. There is nothing wrong with it. But if you really think that yes, my TSH is normal, but there's still something could be wrong with my thyroid, you can always ask your GP to ask for a full profile, especially if you've got a strong family history and you don't have a cause for anything else happening in terms of the symptoms of your body, until and unless you are a woman from 40 to 60 years of age and you can blame it all on menopause or perimenopause. But otherwise, ask your GP to do a full thyroid profile, and if possible with thyroid autoantibodies as well, especially if you've got a family history. Enough for today, but yes, always ask, is it my thyroid?